Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update on the pandemic. Let me start today by talking a bit about what is going on internationally. You may have seen in the news the situation in India that is not good. India has 1.3 billion people, about 4 times as many as we have in the United States of America. You can imagine the challenge of trying to produce enough immunizations and operationalizing a plan to immunize 1.3 billion people. Because of this, very few Indians had been immunized. We know that when there are many people who are not protected against the virus, the rate of transmission goes up rapidly. We know that as the virus passes from one human to another, it increases the probability that the virus may mutate. And these new strains of the virus have the possibility of becoming more infectious. So you have seen some very difficult to look at pictures of what has been going on in the Indian health system because it has become overwhelmed by illness. Now let's compare that to the situation in Great Britain. Great Britain, and England in particular, is just about returning to normalcy. And why is that? It's because they've immunized a very high percentage of their citizens. Many more people on average have chosen to be immunized, and the government has done a good job of making immunizations available to them. So there's learning in this story for us in the United States. We're doing pretty well now. In Maryland, we are back to roughly 740 Marylanders in our hospitals, which is way down from where we were just a few weeks ago. We are about at the level that we were at last October. We're not completely done with this yet, but things are headed in the right direction. The test positivity rate is down around 2% and has been there for a few days. And at GBMC today, we have 18 people who are COVID positive and in hospital beds. And only 3 of those are in the intensive care unit, and only 1 is on a respirator. So the news at GBMC is good and getting better, just as it is in the state. You saw on TV and in the news, the governor is now removing many of the remaining restrictions, but we still need to be a bit careful. You should still wear your mask indoors when there are people who haven't been immunized or you are not sure. There's some other good news now, and that is that the FDA has approved for emergency use the Pfizer vaccine for children 12 to 15. And we will start immunizing that group very rapidly. We know that that group is not very likely to get very sick from the virus, but we also know that they get the virus and can transmit it to others. So we are working hard to get that group immunized, which would leave only young children up to age 11 for whom there is not emergency use authorization for any vaccine, but studies are underway. And as soon as those studies show that they are effective and safe, the FDA will issue emergency use authorization in that group as well. And we will continue to immunize the population. We ask everyone to talk to people and encourage them to be vaccinated if they have not yet been vaccinated. because we want to get that rate of immunity up in the population such that the virus will cease to be transmitted from one person to the next. Now, this is hospital week, so let me end by giving a shout out to all my colleagues in hospitals in Baltimore, across the country, and across the world for that matter, for standing up against this scourge. They have done an absolutely fantastic job. So until we speak again, be safe, and if you need care, we are here to serve you at GBMC.